So the pregnancy assessment is a very important time to not only assess the physical, emotional, mental well-being of the pregnant person and the family if they are present, but it's also an opportunity to provide patient education, to help the family prepare for the birth of their new baby, and to prepare for the delivery process as well. When we are assessing a patient who is pregnant, just like any other assessment, when abnormal findings are identified, it is very important, it is incumbent upon the nurse to probe a little further, to have an understanding of what is going on, to be able to take an opportunity to provide patient education around whatever issue has been identified, to establish a plan, of course in collaboration with the patient, in regard to follow-up, and to, of course, document everything.
Come in. Hi, Ms. Smith. Good morning. My name is Arlene Sarasua. I am one of the nurses working at the clinic here. It's our first visit together.
Yes, it is. I've been here before, but first time with you.
Great. So can you just give me your full name?
Mary Lou Smith.
Okay. So what we're going to do today is we're going to chat a little bit. We're going to talk a little bit about how this pregnancy has been going. I'll ask you a number of questions. You've likely been asked some of these questions in the past.
Okay.
And then we'll do a bit of a kind of physical assessment so that we can see how things are going and how you're feeling and all of that. You'll have an opportunity to ask questions as well.
Great.
Does that sound good?
Sounds perfect.
If at any time you're feeling uncomfortable or you'd like to stop, then no problem. We can take a little pause, or you can ask questions, whatever it is that you need.
Great.
Okay.
That's good.
Good. So, what's your date of birth?
May 1st, 1985.
That's it. Okay. Great. I am going to be asking you questions from what we call our intake questions. So I'll be writing things down, but you have my full attention. I want to make sure to capture all the information that you give me. Great. Okay. So your emergency contact would be?
That would be my husband, John Smith.
Okay. Perfect. And do you have who's your primary care provider? Do you have a physician or an obstetrician, family doctor, midwife?
Yes, I have an obstetrician.
An obstetrician. So it's Dr.
Johnson.
Dr. Johnson. Okay. Perfect. So we'll start by just talking a bit about the pregnancy, so I have a sense for kind of where you're at. What was the first day of your last menstrual period?
That would be July 11th, so 2018.
July 11th. Okay. Okay, so that would put you at, if I look at my pregnancy wheel, that would put you at 26 weeks gestation. Is that?
Yes.
Does that make sense? Yeah?
Yes. This week.
Okay, is that consistent with your ultrasound?
It is. Okay. My last ultrasound, yes.
Yeah, so the dates actually match. That's nice. They don't always match. So in terms of your pregnancies, how many pregnancies have you had?
In total, I've had 3 pregnancies.
Okay. And do you have any current children?
Yes, I have 1 child at home.
Okay.
A little girl.
A little girl. Okay, she was born at what gestational age?
So she was premature. She was born at 32 weeks.
Okay. And how long ago? In what year was she born?
2015.
Okay. And so she was born premature.
Yes, she was.
And your other pregnancy?
I had a miscarriage.
Okay.
I had a miscarriage in 2014.
2014.
Early along,
Okay.
I think it was about 4 or 5 weeks along. So
Oh,
it was very
quite early.
Yes.
Okay. So we'll just go through a few questions about this current pregnancy. Was this pregnancy planned?
Yes, it was. Yeah.
Okay.
So we had our first daughter.
Mm-hmm.
Then we got married, and so we wanted another child. So definitely we knew that was in the plan. So
Great. How has the pregnancy been for you this far? From a point of view of symptoms and generally how you've been feeling?
So not too bad. I didn't have too much nausea in my first trimester. Very tired though.
Okay.
Extremely tired.
Still very tired?
Much better. first trimester. Now I've actually have more energy. I can do more things. I'm usually a very active person. Wasn't very active in the first trimester, so now I'm trying to get more into, you know, a little bit of a more routine exercise.
Right. So your energy's picking up.
Definitely.
Yeah, it's pretty typical in second trimester. Although not everybody has that advantage. How about constipation?
Nothing.
Nothing. Amazing.
I never had issues before.
Okay.
My fiber, I'm trying to keep it, my intake at a good level.
Good. And your fluids as well.
Yes.
Okay.
I drink a fish.
Okay. 3 liters a day, approximately.
At least.
Oh, great. Good.
No,
Good. And sleep?
sleep is okay. Recently just trying to get comfortable.
Mm-hmm.
I'm usually a stomach sleeper, stomach side sleeper.
Right.
So now getting used to just sort of one side or the other.
Yeah.
Trying to avoid the back. I know I shouldn't be on the back for too long. And then I have to get up to go to the bathroom at least once a night.
Yeah.
So
Yeah.
that.
Do you have a pillow, a body pillow, or something that you can kind of put under your belly to help support?
I do. I
as
sort of like
it
2
grows?
pillows. Sort of encompass myself in pillows all around.
Oh, good. So you're all organized. That's amazing. Great. How has your mood been during this pregnancy?
Not too bad. I do have a lot going on just with work, and then I'm back in school part-time, so just juggling those two has been a little bit stressful, plus this pregnancy. But otherwise, I've been feeling good. This I had we went on vacation, so that sort of helped
Oh, that's nice.
a few weeks ago.
What are your plans for school when you deliver? Will you be finished by then, or
I will not
are you
be finished
thinking-
by then. I'm thinking of taking a leave. However, I have talked to some friends who have children. I have, this is going to be my second one, so juggling that, I'm not sure. I think if it was my first, perhaps I would continue, but I might just sort of stop for a year and then go back into it.
Okay, so you're just trying to figure out how you're going to manage sort of all of the demands. Okay.
I'm definitely going mat leave from work.
Yeah. Well, you're entitled to it. Do you have a spouse?
Yes, I do.
Yes.
I'm married.
Okay. How female, male?
Male.
Okay. And is in terms of his mood throughout the pregnancy?
He's been good.
Okay. No concerns in that area.
No. The first pregnancy, I think, just because it was our first child, afterwards adapting to a life of, going from 2 of us to 3 of us to popping another human being in was difficult. I think adjusting to that took a little bit of time, but now we're ready, and we're ready to add another little human being to us.
Good. Okay. It's something we ask, especially of late, because we have more of an understanding of mood affecting both partners in the context of pregnancy and postpartum. So it's just something to keep in mind.
Okay.
Have you experienced any abdominal pain?
Some pain here and there. Nothing that lasts.
Okay.
Just like little sharp pains. But last time I was here, I was told that it was just sort of my uterus growing, everything expanding.
Okay. And so you say that it doesn't last?
No.
It doesn't last. So how long does it last for when you have a pain? Just a little.
Yeah, a few seconds.
A few seconds. Okay.
And then it subsides.
Any back pain?
No. Thankfully,
Yeah.
no issues there.
Okay. And how would you describe the pain in your abdomen when you get it?
Little sharp pains.
Little sharp pains. Okay. Okay. And did you get them every day?
No, maybe once a week or once every 2 weeks.
Okay. Okay. And you rest and they go away, or they just kind of come at any time?
Usually at the end of the day or after a long day, I notice them. Then when I rest, I lie down, they subside.
They subside, yeah. Okay. So it could be little contractions. Any vaginal bleeding or unusual discharge?
Nothing.
Nothing at all.
Excellent.
Okay, good. Do you have any cramping? Well, I asked you about contractions in your lower back. Any vision changes or headaches?
I have had headaches. That was earlier on, I would say closer to my first trimester. And there was a week that I had them almost every day, and then they've subsided since then.
Okay, so
nothing
no
since-
recent headaches?
No.
Okay.
Really, I can't remember the last time I had a headache, and no dizziness ever. actually that I've
Okay.
noticed.
Any epigastric pain? So pain right about here
Sometimes after eating.
after eating.
After
Okay.
eating large meals.
Okay.
Yeah.
Okay.
So now I've sort of paced myself. I was trying to eat smaller meals throughout the day, and that's helped a lot.
Okay, good. So you would attribute it to indigestion, that sort of
I
thing?
think
is,
so.
Is from your point of view? Okay, have you felt the baby move?
Yes.
Yeah, you're at 26 weeks, so it would have begun a few weeks ago,
Yes.
the movements.
I wasn't sure at first,
Uh-huh.
but definitely now it's sometimes I think they're just going at it in there.
Okay. You say they. Single
They.
fetus. One baby. Okay. Great. Those feet are going at it.
Yes.
Okay. So when, in terms of your gynecological history, when was your most recent pap test?
So I had it actually at the beginning of this pregnancy.
Okay. Perfect. And have you had any abnormal pap tests?
In the past, ever? No.
Okay. Have you had screening for sexually transmitted infections such as gonorrhea, chlamydia?
Yes, I have. Again, at the beginning of the pregnancy, and everything was negative.
Everything was negative. Do you have a history of any of those infections?
Nothing.
So, okay. How about hepatitis B?
No.
In your recollection, HIV?
Nothing.
Okay. And genital herpes? No. Okay. So these are typically, hepatitis B and HIV are ones that we will take blood tests for anyways, and you've already had your screening for the other bacterial infections. Do you have any medical conditions?
No. Nothing.
No diabetes,
No diabetes.
asthma,
No asthma.
hypertension. No, I'm just prompting you just 'cause sometimes we
Yeah.
kind of forget that we had something when we were younger and then it suddenly comes up again during pregnancy. Okay. Depression or anxiety?
No, after my first pregnancy, again, because of it being the first child, I did have a little bit of, the baby blues.
Okay.
That lasted about, I don't remember how long, but I think just that transition, talking with my family, friends, my husband is a good support system,
Okay.
helped me through that. And then when we just sort of, it was really just the beginning stages postpartum. But
Do you
nothing.
remember how long that lasted for? Sorry to interrupt.
No, I want to say about a month.
Okay.
Where before I really started feeling like myself again. I've got this. I can adjust now to this new lifestyle, and I think a good month before I felt 100% back to my normal self.
Okay. You will notice that the questions that I ask you are ones that we want to make sure that we follow up on. So they're ones to just take note of in terms of following up in the event that they occur. So if mood changes, if you get some of the physical symptoms that we talked about, like headaches or blurred vision, these are the types of things that you want to bring back to us and make sure that you make an appointment for. Okay, I'm going a little back and forth, but I want to make sure that you're aware of that. Any medications?
No, I don't take any medications. I did take, when I went on my trip, I did take an aspirin before the flight, both flights.
Okay, an aspirin? Like ASA?
Yes, an aspirin. When I actually spoke to the doctor prior to leaving, just mentioning that when I was younger, like 16, I had a superficial blood clot in my foot.
Oh, okay.
And at that point, and I just noticed after flights, just in general, when I'm not being pregnant, I have very swollen legs. I wear compression stockings always on the flight, so I just mentioned that to him, and he said I could take an asprin before the flight, going and coming back.
Okay,
So that's what
so
I did. I
you
drank
ran that
lots of
by your
water.
physician.
I walked in the plane. I put some compression stockings on. So that's not something I take on a daily basis. It was just for that. Otherwise, on a daily basis, I do take my multivitamin.
Okay.
I take a vitamin D, and that's it on a daily basis.
You said vitamin D
Vitamin D.
and your multivitamin. Do you take any other herbal medications, any homeopathy, anything else?
No.
Okay, perfect. Do you have any allergies?
No, just some seasonal allergies.
Okay, so seasonal, no food allergies.
Nothing to food. My tongue gets a little itchy after having a kiwi. I just avoid them completely.
Okay.
other than that, no food allergies.
And you've never been made aware of an allergy to latex?
No.
I can sometimes come with kiwi allergies.
Okay.
Yeah.
No,
Okay.
never. I remember now actually, when I did get my wisdom teeth taken out, I was prescribed amoxicillin.
Yeah.
But I broke out into a full body rash, stopped the antibiotic, and it sort of stopped from there. So I've never taken it since.
Okay. So those are, when you come to hospital and ask about allergies, it will be very important that you mention both of those. That you mention amoxicillin, even though it's in the past, and that you mention kiwis. We will put an allergy bracelet on you, because you might get an antibiotic, and we want to make sure that there is no that it does not have sort of cross allergy with amoxicillin.
Okay.
Okay. Do you know your blood group?
Yes, I
Blood
was.
type?
Yeah. Again, I got that tested my first pregnancy. A positive.
Okay. So we're gonna do it again in hospital, most likely, depending on where you deliver. But it's important to know. Have you ever had chickenpox?
Yes, as a child. Yeah.
Okay, great. Are you up to date with your vaccines?
Yes, as far as I know.
Okay. We're gonna be doing later in pregnancy a rubella test as well to determine whether you're immune to it
Okay.
or not, and then see whether after pregnancy we give you a vaccine. Any family history of any chronic conditions? So, for example, high blood pressure or diabetes.
High blood pressure, diabetes, nothing that I can think of. My grandfather passed away of chronic kidney disease.
Okay.
Both actually. My mother's and my father's side. My grandmother had colon cancer.
Any congenital anomalies? So what we used to call birth defects. We typically don't like using that term these days, but any of those in your family?
No.
So babies born with any type of anomalies? No?
No,
Okay.
no, that I can think of.
Okay, so you mentioned that you're taking your multivitamin every day, so that includes folic
Yes.
acid. Okay. Are you on a special diet? Are you vegan, or vegetarian,
No.
or do you avoid any foods?
No. Well, now I'm avoiding like just all the pregnancy no-nos.
Right. Okay. And kiwis.
And kiwis.
Okay, perfect. Any food intolerances apart from kiwis? Anything else that makes you just feel uncomfortable that we wouldn't call an allergy?
No.
No? Okay. Are you craving any foods?
Not really. More savory than sweet. Otherwise, like some
Chips, nuts?
cravings. Yeah.
No?
Nothing. Apples at one point, but that's sort of subsided, and now it's just anything really.
Okay. As long as it's healthy.
Yes.
Yes. Okay. And are you craving anything that is non-food?
Non-food. What do you mean?
So some women during pregnancy may crave eating dirt
Okay.
or chalk or other, and nothing like that.
Nothing like that.
No, you haven't. Okay. Okay. How do you plan on feeding your baby?
So I breastfed my first child, and it went well. I had difficulty in the beginning, just getting used to it, which positions. So I'd like to do the same thing for my second.
What's your occupation? So you mentioned that you're going to school and that you're going to be taking a leave from work. What is it that you do?
I'm a kindergarten teacher.
Oh, okay. In terms of the physical demands of work, I guess we can imagine what a kindergarten teacher does. It requires a lot of energy.
Yes.
I would imagine it may have been difficult during your first trimester.
Yeah, very tired.
Yes.
Just on my feet all day, running around. But it's a lot better now. I think the most, I guess, physically demanding aspect of the job would be just constantly on my feet and watching and going.
Okay. So you've been in touch with your doctor with regard to preventive leave, when it is that you would leave
Yes.
work, and all of that.
Yeah, we've discussed that.
Okay. For your baby's well-being and for your well-being, we ask these following questions to all the families that visit us, because they are important questions. You mentioned that you have a spouse. Do you feel safe in your relationship?
Yes, very safe. He's very supportive. Very supportive with the first child, and just overall.
And he's going to be present at the delivery, is that the plan?
Yes, that's the plan.
Okay, perfect. So at subsequent visits, you might want to bring him in so that there's an opportunity for, education. We can talk a little bit about some of these, red flags that we've discussed throughout this interview so that he's aware of them as well.
Yeah, he usually comes with me, but he couldn't get out of his work meetings today, so unfortunately.
Yeah. There's so many
Yes.
appointments too that it can be a bit of a challenge. Do you drink alcohol?
Yes, I do.
Okay.
I have a glass of red wine maybe once, twice a week.
Okay. What is your knowledge of recommendations around alcohol use in pregnancy?
So alcohol, I was always told, or like maybe not always told it by my friends, that, if you have like one glass a week or one glass with dinner, it's fine. Maybe just don't have it in the first trimester. So I didn't have anything in the first trimester, but now with my meals here and there, I'll have a glass or two a week.
Okay. So the Canadian recommendations around alcohol use in pregnancy are to avoid it altogether. And the reason why, historically, we had this sort of thinking around, you can have a glass every once in a while. Some would even talk about a glass a day. Perhaps in Europe it was a little bit more permissive, but now really globally we're talking about abstaining from alcohol during pregnancy. And the reason why is that there's no known minimum amount that has the potential to cause harm to the fetus at any gestational age. So I'm giving you the information so you're aware that is what is recommended in Canada from a public health point of view. That's recommended. So.
Well, thank you. I didn't know. I thought that it was known that 1 glass, 2 glasses a week has no effect on the fetus, but I didn't know that. Thank you.
So, yeah. Do you smoke?
No, I don't smoke.
Tobacco or marijuana?
No.
Does anybody in your entourage smoke?
Yeah, so my in-laws, they're European. They live here. When they come over, they do smoke. I do tell them to go outside most of the time. Sometimes I think when they were living back home, they would just smoke in the house, and that was normal for them. So here I try to, especially with the little one at home and myself being pregnant, so I do try and push them outside, but sometimes they forget. Yes.
Right. And has your husband been involved in speaking to them about going outside?
Yes, so we've tried together to sort of, so we're still working on that.
Right.
But they have, it's been a lot better, because in the beginning when I first met them, before the kids, they would smoke in the house, and it was harder. But now I think, with the children, with myself being pregnant, I think they're more open when we ask, and they're not as offended. Let's say. So
it's tricky. It's tricky with in-laws for sure. So you have an understanding of the avoidance of secondhand smoke.
Definitely.
Okay. So some of the strategies that you have them go outside and you do your whole political thing within your family to try to get them to go outside. They might want to also make sure that they take off their jacket or their sweater if they come inside, so at least you're avoiding exposure to what we call third-hand smoke, which remains on the furniture, remains on people's clothing, that sort of thing. So I know it's delicate, but anyways, the two of you will figure out how to stay on that. Do you exercise? You mentioned being active.
Yes, so I have actually just recently started becoming more active.
What type of exercise?
So I started yoga, prenatal yoga, once a week, and hopefully we'll continue that to the end of my pregnancy. Just because for first trimester it was just impossible, and just, walking would just be done. But I already feel better. Like I just, not being able to exercise or not being able to physically do anything, it was really hard for myself. So I'm excited to get the yoga going.
Yes,
That's great. That's great. It is very much encouraged to maintain physical activity throughout pregnancy. Do you have any concerns in regard to pregnancy? Any questions for me before we go on to doing a little bit of a physical assessment?
Nothing that I can think of at the moment. If anything comes up.
Okay, so I'm just gonna exit the room, have you put on a gown, and I'll come back and then proceed.
Great.